stay tight.
Okay, that looks good.
Yeah.
Everybody good?
Yeah.
Yep.
Good morning. Thank you for joining us here at the H. Lee Dennison building. I am joined by a number of my colleagues who have been involved and remain involved, of course, in our response to the coronavirus outbreak. I want to recognize them and thank them for the work that they've been doing. Dr. Gregson Piggott, our Commissioner, Suffolk County Department of Health Services, who will be speaking in just a few moments as well. Dr. Shahida Iftikhar, Deputy Commissioner for Department of Health Services. Of course, Suffolk County Chief of Police, Chief Stuart Cameron. The Director of the Suffolk County Office for the Aging, Holly Rhodes Teague, and Director of Operations, Suffolk County, Tom Vaughn. As we expected, the number of coronavirus COVID-19 cases is rising in Suffolk County. As of this morning, we have 6 confirmed cases in Suffolk County. The first patient, a male in his early 40s, remains in hospital isolation at Southampton Hospital. I'm happy to report his condition is improving. Second patient, a town of Brookhaven resident, is a male in his early 20s who is currently in isolation at Stony Brook University Medical Center. The third patient, a Southold town resident, is a female in her early 20s who is under home isolation. The fourth patient is a male in his 80s in isolation at St. Catherine's Hospital. The fifth patient, a town of Brookhaven resident, is a male in his late 30s in isolation at Stony Brook University Medical Center. And the sixth patient, a town of Brookhaven resident, is a male in his early 30s who is also in isolation at Stony Brook University Medical Center. Just as we did with the first confirmed case, Suffolk County communicable disease professionals have begun a thorough investigation into the patient's contacts, as it is believed that all of the cases here involve community transmission. We are continuing to work closely with the New York State Department of Health to ensure a swift and effective investigation around all the confirmed patients. So far, we have 8 individuals now who are under mandatory quarantine. That includes one of the 6 confirmed cases of COVID-19. We are doing that, of course, to help prevent and contain the spread of the virus. As our communicable disease professionals continue their close contact investigation of those who have tested positive, we expect that number to continue to rise. We want to ensure that everyone who might have been exposed to the virus is isolated to the extent that we can. In addition to our 6 cases and individuals under mandatory quarantine, we are currently monitoring 72 individuals under precautionary quarantine. These are all individuals who recently returned home from abroad. So all of the individuals right now who are under precautionary quarantine are all travel-related cases. I want to emphasize that every one of these individuals has been screened and none are symptomatic at this point. So this is an entirely precautionary measure. And the health department checks in with these individuals and continues to do so on a daily basis. So just as I talked about when I stood here on Monday, I want to reiterate that there is not a cause for panic in this circumstance. The professionals who are charged with doing this work are busy at work every day. And the effort here is about containing the spread of disease because that is the right, prudent thing to do. And we are in continuous coordination with the New York State Department of Health. And of course, we are following guidance from the CDC and the State Health Department as we move forward. And what we continue to ask people to do is to exhibit common sense and do common sense things. And that means, first and foremost, washing your hands. We continue to emphasize the importance of that to help mitigate and contain the spread of the virus. Use hand sanitizer if it's available as well. That is not a substitute for washing hands with soap. Very important to understand. That's the first and best thing you can do. If you have hand sanitizer available, that's also an option to supplement that. Avoid unnecessarily touching your face. That is how you're going to see the virus spread. It's not, that you're just going to contract it. You're going to touch a surface, touch something, and then it's going to, in your eye, your mouth, that may cause you to contract the disease. So that's important. And wipe down those surfaces where the germs, the virus may be. Continuously wipe down those surfaces as best you can. So again, our health department, I want to thank them and all of the people who've been working very hard on this to keep people healthy and to work to contain the spread of the virus. I want to thank them for the work that they're doing. We've been preparing for this since the beginning of February, a multi-agency response, and that continues as we move forward here. And as we know, with the ramping up of testing, more cases being confirmed positive. Again, we know that most cases involving the coronavirus, 80% of the people will either be asymptomatic or will have relatively mild symptoms, and that there are certain groups who are more susceptible and groups for which this virus is much more dangerous, and that includes older Americans, of course, and those who have some underlying medical condition. Suffolk County Health Commissioner Dr. Piggott, who's going to speak in just a few moments, will provide guidance for our older citizens, and I'll let him talk about that. The underlying message here, though, is that older residents should avoid large gatherings. Whenever possible, older residents should avoid large gatherings and be prepared with supplies at home. As testing becomes more widely available, and that process has been underway for the last couple of weeks, it continues to ramp up, we will continue to follow the guidance of the CDC and the State Health Department with respect to testing. But again, as more testing happens, we can expect to see more cases, and that's just a natural effect of having more testing availability. Again, I want to emphasize that no one should have the expectation that they're just going to walk into a doctor's office to get tested. If they're feeling symptomatic, you can reach out to your doctor's office. They'll guide you from there. If a recommendation is made on testing, that will come to our county health department. We'll be in consultation with the state health department. When that changes, obviously we'll provide that guidance, release that information, as I'm certain the state health department will. So we are committed to doing everything that we can to contain this virus, and we will work with all of our partners to provide our doctors, hospitals, and first responders the tools that they need to ensure the health and safety of our residents. For any residents who have questions about symptoms, travel concerns, and tips on preventative measures, you or your loved ones can go to the county website. It has all of the latest information, suffolkcountiny.gov, on the cover of the county's webpage. If you do not have access to a reliable internet connection and need to call, you can contact Suffolk 311, where you will be directly connected to a live operator who can direct your call to the appropriate place or provide information that is available. As always, medical professionals will continue to contact our county health department directly, as they have in the past. And as this situation continues to evolve, Suffolk residents, and this is important, should know that all levels of government, federal, state, and local, are doing everything possible to combat the virus and to contain it. And finally, I'd like to thank the public for heeding the warnings and playing their role in helping to reduce the spread of the virus. So with that, I want to turn it over to our Health Commissioner, Dr. Piggott, who will provide guidance for senior citizens, and other vulnerable populations. Dr. Pickett?
Please just spell your first and last name, Dr. Pickett.
Gregson, Gregson, Piggott, Pigott. All right, so I'd like to say that what we're learning about this virus is that our younger populations generally do very well with this. They have some flu symptoms and generally recover without much help. But our senior population, we're talking about adults that are in their 70s and 80s particularly, can do really badly with this virus. And so while we know that the cases that we have identified in Suffolk County are predominantly community spread, and they're all community spread. In other words, there were no known risk factors for the person to have the virus. We are concerned, especially for our senior population, that they avoid places where people could inhale respiratory droplets. That's what we're seeing, is that folks who are coughing or sneezing especially, and spewing out respiratory droplets. So this is, liquid that comes from the mouth or from the nose. When those get in the air and somebody inhales them in, that's when you can be exposed to the virus and get sick. So we really want our seniors to just be careful about going to large crowds, large gatherings, places where they could be exposed to this virus and contract a serious illness. So we prefer that our seniors try to stay home as much as possible, and go out maybe in limited amounts of time, and generally just try to wash their hands and keep out of harm's way.
Thank you, Don. Thank you very much, Doctor. Any questions?
Are any of the six connected to each other? Six people?
Two of the six individuals have a connection.
Can you say
Yes.
which two and how they're connected?
Can we say that publicly?
The South Fulton.
Okay, so the first and the third patient are connected to one another. There's a connection there.
Can you say
Yeah.
what the connection is?
Well, no, we can't get into the specifics of the connection, but there is a direct connection there.
And Steve, can you say which of them is under mandatory quarantine, and what determines if they're under mandatory or just cautionary quarantine?
Precautionary quarantine involves, in this case, all people who have come from abroad and returned home. Mandatory quarantine involves people who either have contracted the virus or have been in direct contact with individuals who've contracted the virus.
But there's only one of the six who's currently under mandatory?
One of the six is under mandatory quarantine. The others are hospitalized at this point. Anything else?
Yeah, the mandatory quarantines are people that we have identified as close contacts of a case. All right, and so those, by definition, you might have been exposed to that virus, so we want you to be quarantined at home.
And are test kits available in the county yet? What's the process for people to be tested?
So I'm sorry. The testing, what the testing kits are basically all of the information that the CDC has about the virus and the information that is required to do testing. Those test kits were shipped to local labs not that long ago, and the local labs need to do a lot of preparatory work in order to be able to do the testing locally that the CDC was able to do. And that's been one of the things that's limited the amount of testing, the availability of those test kits to labs. They have those. They've been ramping those up. They are working to automate them, which means they can be done more quickly. So our testing capacity is increasing. But the guidance is essentially the same at this point, and that is no one who feels symptomatic, who may in normal situation believe they have a cold or the flu, symptoms like that should be expecting to just go to a doctor's office and just get a test if they want to test. There's an evaluation that would be done. They would make a determination. There's a determination with the health department, and if testing is required, that's what will happen. When that guidance changes, state health department and we will put that information out. But that's where it is right now. People shouldn't expect, if they're feeling under the weather, that they can just go in and get a coronavirus test.
Once the test is approved, how long is it taking for results?
3 days.
3 days. That will, as the testing is ramped up and automated, that will change significantly.
And which of the patients is the Peconic Landing employee? Can you say? Is it per diem?
Yeah, we can't comment on that.
Is there any extra precaution or what's being done in that facility? There's hundreds of residents there, so what's the concern out there right now?
I could say our nursing staff, we're investigating that case and we'll have more to follow, but at this time, it's a little premature to comment on it.
The investigation is continuing now.
Are you coordinating with retirement homes in terms of, like I know some retirement homes are cutting off visitors to keep things contained?
That's related to what we saw in Kirkland, Washington, that you had, the suspicion was that somebody, an outsider, had the virus and brought it in, and that the whole nursing home population there was exposed to the virus. So I think out of an abundance of caution, it might be a good idea for visitation to be limited in those kind of settings.
Given the 3-day lag time, how many tests are pending currently in the county?
I believe it varies now, because what has happened that the local health department used to be the repository, the gatekeeper of all the testing, but now we have LabCorp, we have Northwell Labs. They are also doing testing, and so we're finding out after the fact. So it's difficult to say what we have pending right now. As of yesterday, we had 12 tests outstanding that we know about, but I'm not sure about the commercial labs.
Some of the patients are in Stony Brook Hospital. Are any of them connected with the university?
I don't know that right at this time.
Sure.
Can't confirm that.
The one patient is in St. Catherine's, not St. Charles?
St. Catherine's.
Positive?
I know you said the Norfolk ones are connected. There's 3 in Brookhaven, but Brookhaven's obviously like a really large town.
Yes.
Can you be more specific? Are they in close proximity, or are they spread out around the town?
Yeah, we're working on those cases right now. We just found out yesterday, late afternoon, so we have to really dig into those, but it's a little too soon.
At this point, there's no known connection between those cases.
Any other questions? Thank you.
Thank you very much. Thanks, Doc.
I'll watch my kids.